So why are Crocs hurting our kids' feet? Let's have a little discussion here. But I think it's worth kind of going back in time and finding out the purpose with that first original Crocs model. It's called the Beach. And I think it actually kind of looks something like this. It was unveiled in Fort Lauderdale, a boat show in 2002. It sold out, and the shoes became widely accepted. They're very popular for boaters, and then, kind of exploded a little bit more because it was practical. They were kind of funny looking. It was lightweight, durable, and of course it was waterproof. So why is it so popular to stick our kids in the Crocs today? I would say it's decently affordable. It's easy to slip on and off. It's got a backing here, which is great for kind of being able to go with you when the kids are walking. It's got some fun designs. I get it. My kids got the Hello Kitty one and some charms. You can kind of, make it personalized. And, it's just easy. I think I can do it with one arm and be able to slip them on and off and just kind of go as needed. But I think to a detriment, they do become harmful and they do hurt your gait cycle anytime you're after about 25 pounds. I did my doctoral dissertation and I noted that in my research that your foot ankle increased 27 times your body weight. So you can imagine that what little support they have. I would say what starts happening is that middle arch starts collapsing, and I had that true to form happen to me. Actually, I wore Crocs during my time at the hospital, and I quickly found out that I had a lot of pain, and largely I wanted them because they were so easy to put on and off. And I realized after my experience wearing nice Brooks shoes that after a patient I pulled from sit to stand, they literally pooped on my nice shoes. So I wanted something that was I could just wash off and reuse instead of wasting $150 and then tossing it, because that just happens sometimes after surgery. Sometimes you pull someone up and then they take a dump on your shoes. So I think a lot of the hospital people can agree with me that they probably chose this, but I think if you start this early with the kids, you're kind of forming that bad habit and that lack of support that we need. Now, like I said, I'm all for it. Some of my recommendations is to really allow, if you want, for your kids, maybe around 2 to 3 years old. That's when you start transitioning them out from using them full time or as a full time shoe wear. I'm just seeing them all the time with kids, and they're kind of doing this shuffling motion, and that's really harming their ability to do a full step for their whole gait cycle. So you want to get them in real shoes as soon as possible, or as much as you can. I would say, like I said, after 25 pounds, that's a lot more pressure on those feet. Like I said in my doctorate dissertation, 27 times, that's quite a bit. So you do the math there. But I think if you were wanting to use it after 3 or after they're a little heavier, you're probably not using it more than 1 hour at a time. Maybe you're going to the mall quickly or whatever. But in general, I think my best recommendation to you all is wear them maybe on a rainy, muddy day and doing some gardening and helping out there. Treat it like flip-flops or thong flip-flops where you're using it in pool play. I think this is has a little bit more grip than the flip-flop, which I found, very helpful. And you're not slipping and sliding on the pool deck, which, then you can have coccyx issues if you fall. So that's some way I want you to think of that. And I would say if you're an adult and you're still wearing Crocs all day, every day, come on, I'm gonna shake my head here. You're just doing yourself a disservice, and I see way too many feet issues from this. Every week I say, and usually we want to change that shoe wear as soon as possible. So hopefully you hear my thoughts. Like I said, just some quick pointers again. I would say 2 to 3, up until 2 to 3. Go have fun with them. They can wear it. My daughter loved it, and it's easy. We were doing water play, and then it was just easy to just kind of put her in the water and the little baby pool. I would say after 25 pounds, then you want to start getting them in something with a little bit more support. And then 30 minutes a day, whatever. It's not going to kill you. But after that, just get in get people into supportive shoes. I swear to the day I die, shoe wear is the main reason for foot ankle pain for later in life. And I think if we get our kids in supportive shoes today, or earlier, sooner than later, not because of comfort or look or they're fun, because they are fun, don't get me wrong. I think these were greatly marketed. Like I said, I purchased them myself back in the day. I don't wear them anymore, but if I'm gonna need something like this type of soft foamy material, I might wear it just for the pool days or the beach days or whatever, where I can just easily clean it off. So here are my thoughts. Don't burn me at the stake. I'm just giving you my professional advice. I'm Dr. Lin. Remember, we heal smarter.